an online healthcare platform with over 8,000 products that are curated by doctors. All these products are handpicked by a team of expert panel of doctors for you for your healthy living. So, guys, do check out Cureka.com. We have also got a Cureka store at Indiranagar, Bangalore, which is at a very prestigious location just behind ICI Bank. It's already very popular among the local folks. Do check out if you are in Bangalore right now. And guys, you know who is the special guest with us tonight? I mean, just take a guess. It's a dermato surgeon with us and a very special personality. So, not taking much of your time, let me tell you today's personality with us is Dr. Hema Sathish. Yes, you have guessed it right. She's also the founder and managing director of Cureka.com. So, Dr. Hema Satish is a well known personality in the field of dermatocare across South India, and she has done many critical surgeries. So, just to give you a brief introduction about Dr. Hema Satish, she is a distinguished dermatologist surgeon renowned for her compassionate work in the field of dermatology and her visionary role as the founder of Cureka. With a heartfelt commitment to her profession, she has not only excelled in providing exceptional dermatological care, but has also played a pivotal role in rehabilitating acid attack victims as well. Dr. Satish's contributions extend to her role as a dermatologist surgeon at Devdas Hospital, where her expertise and dedication have positively impacted countless lives. As the founder of Cureka, Dr. Hema Satish has harnessed her extensive knowledge to provide innovative healthcare solutions and wellness products. Her dedication to improve skin health and overall well being has made Cureka a trusted partner for individuals seeking quality healthcare and wellness products. So, not taking much of your time, guys, I'm going to welcome Dr. Hema Satish with us tonight today, and
Dr.
here it
Deepak.
is. Good morning, Dr. Hema. How are you?
Yeah, I'm good, Rahul. Thanks for the long introduction.
Uh, Thank you, Dr. Hema. This was much awaited. Our listeners have been waiting for a very long time to have time to interact with you and with your, thank you for sharing your time today so that people can interact and understand more about you. So, uh, you know, moving on to the first, question which a lot of listeners have for you, Dr. Hema. I mean, you're also the founder of Cureka. So, what is the vision behind you starting Cureka, and how did you come up with the concept, like to start this venture?
Actually, when we began many years ago, that time I used to have a lot of patients who are from the periphery and from far different cities and all. So they will come for consultation once in a while, and then they would want medications. So we used to jot it down, and then we used to tell the pharmacy just pack it and send it across. So that was quite a issue with everybody because if they forget or if I forget to follow up, it wouldn't happen well. And then the numbers it kept increasing. And then once when we went for a conference, we saw that is this e-com is done so much and it's the in thing. This was I think in 2013 or 14, and that time I thought to myself that oh, this would help our patients really well. So that's how we started the company as a very small one where we were catering only to our patients. Now, for the past 2 years or so, we have started supplying it all over India. And we have seen a good growth. So I'm glad that we are able to help as many people as possible, far and wide.
Yeah, sure. So, Dr. Hema, moving on to our first question of the day. So, can you share insights on the latest exfoliation techniques and products that are gaining popularity in skincare?
Well, exfoliation has really caught up. Not only now, it was there since mankind was there, I guess.
Yeah.
When we used to read about exfoliation in our textbooks when we were students, we used to read about how Cleopatra used to use this technique, to exfoliate her skin, and she was spoken about having skin which was impeccable. She was having flawless skin on all over the body. So how and that the secret of that was she used to dip herself in milk mixed with lime.
Okay.
And everybody knows that becomes lactic acid.
Yeah.
So that used to peel her skin regularly. So she used to exfoliate her skin regularly.
Okay.
And that's how she had excellent skin. So this has been there forever. And now with time going by, people have, modified it to several ways uh, to incorporate it in their quick, fast-paced life so that they don't waste time. So there are a lot of products available as of now. If you start with physical items and then you can go to topical applications, which can be from serums to creams, and then there are face packs, you name it, and every anything and everything. I mean, if you should have the right ingredient, though, can exfoliate your skin.
Right, right. And doctor, thank you so much for that answer. Moving on, how does exfoliation play a key role in achieving that coveted glass skin look?
That's everybody's desire to have a very glass skin look. Well, when it comes to glass skin look, there is a little bit of a difference. We usually, we aim at skin which is problem free or which is not having any issues. Like it shouldn't be dry, it shouldn't have pimples, it shouldn't be too oily. So the list goes on. But this glassy skin, which is that Korean culture skin, which is called the Korean beauty skin, is a mixture of quite a few factors. That is, there shouldn't be any pores on the skin. Of course, the diseases are absolute no-no. Then it should be very well hydrated, and then it should be exfoliated also well. So when these things are done in a proper way and in a cyclical way, then this glass skin can be achieved. And this is everybody's desire. But along with this, not only the topical applications, one should keep in mind that one has to maintain themselves healthy inside also. So balanced diet and healthy lifestyle combined with all this routine care surely will help you have a glass skin.
Right, right, right. Thank you so much, Doctor. I'm sure a lot of listeners who are listening to us and some people who have joined us today just now. Guys, we are joined by a very special guest, Dr. Hema Sathish, who's also the founder and managing director at Cureka.com. So she's also a dermatosurgeon. So if you've got any questions around your skin, please mention them in the comment section below and we will try to take them up during this session. So moving on, what are some of the trending natural or do-it-yourself exfoliation methods that you would recommend, doctor?
As I said, it depends. Now, when you talk about exfoliation, you have to be very clear on why you want to exfoliate your skin. So there are many people who believe that if you have a skin which is extremely dry, then you cannot exfoliate again. Then you have to moisturize it. And if you have a skin which is having acne or acne-prone skin,
Yeah.
then what kind of exfoliating agent you would pick? That you have to be very clear on that also. And if you have very sensitive skin and if you're going to exfoliate your skin, you're going to be so red and then you're going to peel so much that you'll need help from a dermatologist eventually. So, keeping in mind what type of skin you have, thinking about what would work best for you, or if you're not sure, consult somebody, ask somebody what would work best for you, because this depends upon the age, your lifestyle, then your any other skin issues or any other health issues also you have. All that has to be looked into, and then this can be thought about. Well, to come to like, some common tips of using. So if you have acne prone skin, then you use beta hydroxy acid serum or a cream containing something like that. Well, beta hydroxy acid is commonly salicylic acid.
Yeah.
So if you're prone to acne, then you can use something like that. If you're very sensitive skin, then you use PHA, that is polyhydroxy acids. That has got a long list. You can, when you're looking at something, you can look at gluconolactone or there's one acid also along with it. Or AHAs are always there. AHAs are very, very popular. And AHAs are meant for a little older skin to get rid of dark patches and all those things. Apart from that, if you're younger and your skin is you have a normal skin, yes, you can give it a shot. Because it does help. But when you're using all these things, make sure you use a sunscreen also in the daytime. So advisably use this in the night and use your sunscreen in the daytime so that you don't hurt your skin too much, because this exfoliants, what they do is they recycle the skin, so they do peel a little layers of your skin, and that helps to when the skin regenerates, that helps to give a brighter glow, a clearer skin, and a healthier looking skin. Well, all that you have to, I mean, it's not that, one serum promises or one cream promises to do some magic and give you brightening skin. It work for everybody. It never works like that
Yeah.
because everybody is different. Everybody's skin is different. Everybody's lifestyle is different. Everybody's dietary habits are different.
Yeah.
And the genetic coding is also different.
Right.
So you have to think and then decide what exactly suits you and then pick the right thing. It'll be perfect for you and it'll work well also.
Wonderful, wonderful, doctor. You touched upon a topic about everybody has different food habits also. So, could you share that what food habits that people can include in their diet to have a better skin?
Well, I usually, if you have to ask me two to three things, which I would say is have a very good balanced diet, number one.
Yeah.
Second thing is if you want good hair, have good protein, have your minerals, vitamins, everything
Yeah.
in your diet. If you can't make up for that, then of course there is always help next door. That is, you can take your nutritional tablets or your supplements, whatever suits you.
Yeah.
It's in many forms now, powders, gummies,
Yeah.
pills, whatever you can think about, or have a very balanced, I mean, proper balanced diet where you calculate everything. If you like to do that, also you can do that. Apart from that, drinking lots of water
Mm.
and my go-to is antioxidants. I always say have an antioxidant-rich diet. So have lots of fruits, vegetables, raw vegetables, and lot of water. And foods rich in antioxidants. Top of the list would be amla.
Amla.
In India, you get amla everywhere.
Correct.
Amla, you can think about papaya fruit
Yes.
that's got high antioxidants. And the list goes on and on. Everybody knows about this.
Yes. Yes. Wonderful. So, doctor, are there any innovative exfoliation tools or gadgets in the market that you find particularly effective?
Well, there are multiple. There are multiple, and you can, as I said again and again, I'm telling you this because you have to decide what your skin type is, what would suit you, because there are equipments from this little rollers which can do a little bit of flicking or taking away the skin, and especially if you're using it with a serum, then it helps a little more also, and that also gives a brighter skin. But that's say you can use it when you have good, I mean, normal skin.
Mm.
I wouldn't say skin can never be good or bad, okay? It's got problems, so why blame the skin?
Right.
So, if you have an issue, then you should approach somebody who's going to help you out and, figure out what will work best for you.
Yeah.
And that's how we also help a lot of our clients because they tend to ask, I'm this age. And sometimes they send pictures also and they said, what would suit me best? And then I do look through it, and then we ask some more questions about if they have any other issues or anything. And then we say, okay, this is the most probable recommended for you. In case if that doesn't work, then you can always get back because, um, every time everything is not right for you, in spite of all the ingredients being right too
Correct.
at times.
Correct.
Such things do happen. But then, in by and large, if you know what suits your skin, what goes well with you, then yes, you are there. And if you use those products well and take care of your skin well, then you can maintain very good skin for a very, very long time. And nowadays, aging and all is age is just a number, so
Mm.
needn't worry on those grounds either.
Right, right. So, what would be your suggestion for working people, working folks out there? Because when they go out for a meeting or probably an important interview or any such thing, they would like to keep themselves very moisturized. Anything, some quick tip for them that they can use to look good or probably feel confident?
Yeah. Rahul, I'm sorry, but I missed one point before when you asked me what are the type of exfoliants, because there are some derma rollers also
Okay.
available, which has
Yeah.
got small needles, you can just rub them on your skin and
Yeah.
it goes a little deeper and helps and all.
Yeah.
So there are people who try that also,
Yeah.
but I would advise that try it with your dermatologist or make sure that you know that this is the right thing for you and don't use on when you have any kind of pimples or anything,
Yeah.
or if you have extremely dry skin, then that's not for you.
Correct.
Then there are some other kind of brushes.
Mm.
Then there are small equipments which rolls and exfoliate. But these all should be done only once in a while. On a regular
Mhm.
basis, you can apply some cream or serums or
Mhm.
packs. All this would help. So
Okay.
just to complete the last one, and
Yes.
then I
Yes.
continue to this question which
Yeah.
you asked me. Yes,
Yeah.
moisturizers do help, but it again depends what age is your skin because a younger age always has the oil secretions right if you have absolutely
Mhm.
normal skin. If you have an issue with your skin, then you have to decide what kind of a moisturizer you will need. Like sometimes, when they do procedures or you've done some kind of a thing for them, like if you've done a peel or a laser or something, then your skin is sensitive and the top layers are quite vulnerable. At that time, we try to give you more emollients and we give you some kind of a ceramide also. But then that might not be needed once the healing process is over. So then you'll have to switch over to something else, which is a lighter moisturizer or a day kind of a moisturizer, which is not too heavy. And when it comes to moisturizers, we can categorically tell them that is it a lotion, is it a cream, or is it an ointment? So, depending on what the skin requires, that is how dry it is, how much it can absorb, and what type of skin you have, depending on all that, you can pick and choose your moisturizer really well. And then, of course, little knowledge on ingredients also would help you take you a long way in that.
Right, right, right. Thank you so much for that. I'm sure this will be helpful to a lot of listeners, guys. If you've got any questions, please do mention in the comment section below. We have a question from a person. His name is Heart Happy. He's asking, "Hi, ma'am. Can men do exfoliation to avoid thick skin in beard area?"
Yeah, you can. It's usually treatments are not like male, female, and all, so it's generally applicable because as a dermatologist, we do not segregate that. But yes, the male skin has got a little more extra characters and features which are different from the feminine skin because of the hormones which act upon them. But
Yeah.
when you said you have this thickening in the beard area, that clearly means that there is a lot of friction when you're so you try to use maybe some kind of a moisturizing shaving gel or something like that, or a moisturizing shaving cream, and post that don't use any alcoholic agent or something which dries up your skin, so that it's probably irritating your skin and that's why it's leaving the thick layers behind. But yes, nevertheless, you can always use an exfoliator, but don't try to rub it too much, thinking that no, just one day you're going to rub it off that way. So take your time, maybe choose what is best for you, and then continue using that for quite some time, and that will help. But to stop this recurrence is what the part one of the answer was.
Right, right. So I'm sure, Happy, you would have got your answer. Moving on, we have got a question from Prema. She's asking, can salicylic acid help pigmentation on cheeks during pregnancy? Is it safe to use during pregnancy or breastfeeding?
Well, I usually advise not to use anything during pregnancy and breastfeeding because the hormones are so topsy-turvy, I tell you, that anything and everything can react. And especially if you have a sensitive skin, then suggestively hold forth, go slow on everything. And then once the delivery is done, if you have a problem, yes, you please go and approach your dermatologist. They will be able to help you out. And usually when you have pigmentation during pregnancy, it's more of a melasmic kind of a, this is called melasma, where the hormones trigger off this pigmentation. So in those cases, if you're going to, you have to be very, very careful, and the treatment has to be very, very judicious because you're like a cat on the wall. Anything and everything you can go any which ways. Quite unpredictable it gets. So you have to be very, very careful. So suggestively use more sunscreens
Yeah.
and wait till your pregnancy is over. Once
Yeah.
you deliver your baby, then we can think about it. Or if you feel it's really bad or it's getting really, I mean, it's getting worse over time, yes, the dermatologist can surely help you out.
Understood. So, Prema, I believe that would have served your answer. If you've got more questions, please do let us know. Moving on, Doctor, we have got another question. Could you please recommend the top rated moisturizers or what ingredients should we look for that skincare experts are favoring in 2023?
Well, skincare experts always favor moisturizer. So it's not the time or the age which is an issue. Well, I wouldn't be able to tell you the names as such, but then yes, when you're picking and choosing your moisturizer, there are three things you have to keep in mind. One, are you taking a lotion, or are you taking a cream, or are you taking ointment? Suggestively, ointments are for skin which is extremely dry. When you see cracks on your skin, or you're having a very sore skin, or it's pinkish in color, or it's hurting you, then you should use a ointment. If otherwise, you can, if it's on your body, then of course spreadability is easier, so you can apply a lotion. But in the lotion also, you can select if you want a thicker moisturizing lotion or a thinner moisturizing lotion. And especially for the face, I would suggest a lighter cream always, until unless you have extremely dry skin and you want to use something else. And you can use that, and suggestively regular sunscreen should be there. That helps a lot, because nowadays the sun really hurts and induces a lot of issues with your skin. So you can, and ingredients as far as it's concerned, I mean, you can look for if you're looking at natural ingredients, then there are plenty in that also. Otherwise, if you're using, then you can look for ceramides. You look for dimethicones if your skin is extremely dry and you have irritable skin. And if looking for lighter moisturizer, then you can look for honey, like humectants in them. Or you look for, if you're having normal dry skin, it's not extremely dry, but you tend to dry up if especially if you're in a work environment where the air conditions are on all the time. Then you can use something which has got some PHAs or AHAs or a BHA also with your moisturizing cream. And otherwise, you can think about using aloe vera in them. Then the list goes on and on. Actually, I can go on and on and on about it. Then there is lanolin. Then there are butters. These are all thick moisturizer. They are occlusives, we call them. So what they do is they occlude the skin. So they block your skin and your pores, so that you don't lose the water content. The TEWL is controlled. That is, the trans epidermal water loss is reduced by using such occlusives. So you can go on and on. Then natural butters and everything also. At times, what happens? There are some lighter moisturizers which have very little butters, and there are some lighter butters also which can be used on the skin, and which will not occlude, but at the same time moisturize really well. So again, if you have a vast knowledge in all these ingredients, then please go through the ingredient list, pick and choose what suits you best. And if you need any help, always you can approach for help.
Right, right. Thank you so much, Doctor, for sharing that. Doctor, we have got a question from Syed coming in. Good morning, ma'am. My skin type is oily. I'm using Biotic brand sunscreen gel SPF 50 without consulting the doctor. Is it good for me, or any side effect will be there in the future?
Sunscreens usually do not cause any side effects, but thinking that sunscreen is a shield and you can apply it and then go out in the sun and blaze yourself and say, no, I'm wearing sunscreen. No, that doesn't work because that's no magical shield which is going to protect. But yes, it does help you from the harmful rays penetrating your skin, especially UVB, and damaging your layers of your skin. So it does help. And since you have oily skin, it's smart of you to have picked a gel, because that will be the best thing for you, or
Yeah.
a very light lotion kind of a sunscreen will also help. But you've done the right thing, so I don't think, Syed, you should be worried about it or you should have any problems with it.
Yeah. So, Syed, I believe you would have got your answer. So, guys, if you got any more questions, please do mention in the comment section below. We'll try to take them up during this session. Moving on, Doctor, in what ways are K beauty and J beauty trends influencing current moisturization routines?
Well, they are actually these are boosting the moisturizing usage
Yes.
a lot, and it is good for the skin also, because earlier a lot of people wouldn't moisturize regularly or wouldn't use a series of things or try a cyclical range of products. Well, coming to K beauty, that is Korean beauty, is
Yes.
glass skin. That is no skin problems, then shiny shimmery skin, poreless skin, and of course no pigmentation whatsoever. And Japanese beauty, that's J beauty,
Yes.
is it's a lighter version rather. So it's like how plumpy your skin is, that is the sheen on your skin, or the texture of your skin. And so it's not I mean, probably it's not pressurizing you as much as the K beauty does. So, and but yes, there are many ways to achieve both of them. It depends on what you exactly want. We always say, it's not mandatory that you say, I want it like this only, I want to be like this only. But you can always select what you like, or what, when you look at yourself in the mirror, you should be happy looking at yourself and how you feel about yourself. Yes, and in both of them, moisturizer is mandatory, because what happens is you exfoliate. Then once you exfoliate, to rejuvenate the skin, you moisturize. So when you exfoliate, and you use a moisturizer, the rejuvenation is much, much smoother and faster. So when you do that, the skin texture improves a lot more. And depending on your skin type, depending on all the factors, you can decide how much of exfoliation you need, and post that how much of moisturization you need.
Right.
So there are a lot of ways of maintaining it. Like some recommend that one day you apply exfoliant, then the next day you apply a moisturizer, or you apply the exfoliant in the night, moisturizer in the morning, and then your sunscreen. So there are many ways of going about it. What suits you best, you can always select.
Sure, ma'am. So Syed is saying thank you so much, ma'am, and
My
thank
pleasure.
you for that answer for the J and K beauty trends. I'm sure that that's a lot of pressure on people to match with those beauty trends. Doctor, can you please highlight some eco-friendly, sustainable moisturizing products that are gaining traction these days?
Yeah, there are many now in the market. It depends if you want a vegan one, then you can go for this butters and natural oils. And oils can be, don't worry, when you say oils, you needn't be having thick oils only. Like there are thin oils, like there is even chia seed oil now, it's very thin oil, and it's easily absorbent, it's very good for the skin. And then you always have the golden jojoba oil, which is excellent for skin and which is equivalent to the serum of your skin. So if you're applying it, even if you have pimples, it's going to help you only. So that doesn't mean just apply it all over and leave it. But then creams made of those things are better. Then butters, you can look at buri tea butter, tukuma butter for lighter versions of butter. And of course, shea and cocoa butter are always there. In small quantities, they can be added. Mango butter also helps if you are using a lighter moisturizer. And then what are the ingredients? Honey can be there, aloe vera can be there, wheat germ oil can be there. You can have rice ceramides, and then of course to increase penetration, you can have BHAs, PHAs, AHAs. AHAs, alpha hydroxy acid in uh, clear fruit form, also helps a lot. And there are very nice versions of retinoids also, which are incorporated in creams for anti-aging. And for anti-aging, earlier also people begin, so around 25, 30 also many people use anti-aging creams. So when they use something like that, so very when they use that early, and if you're using a retinoid, which is a chemical derivative, then what happens is your skin is quite sensitized. So then getting skin problem, not only skin problem, pigmentary problems later in your life gets higher. But with this plant-based ones, as of now, the research shows that they do not irritate the skin too much. So it's advised to use even in the daytime. And even if you're using in the nighttime, it wouldn't, hurt your skin that much that it's going to cause any pigmentary problem later in life. So the benefits of having natural, plant-based, or all these ingredients are going to be higher, and it's going to work well only.
Right, right, right. So I'm sure there's a lot of upcoming good future for eco-friendly, sustainable moisturizing products.
Loads and
Dr.
loads of them.
Yeah. So a similar, question on the trending lines, Doctor. What are current trending solutions for sensitive skin that involve a balance of exfoliation and moisturization?
Sensitive skin is something which is like, vast. Because usually when people see very fair skin, and we call it type 1 skin, and they grade them as sensitive skin. Their skin is sensitive to sunlight and to many things. But if you have to see Indian skin, which we usually not graded as the most sensitive type of skins, but I usually see a lot of reaction on Indian skin because Indian skin is very sensitive. Many of them have very sensitive skin. Of course, if you have a problem, then it's a no-brainer that your skin is going to be sensitive because of the issues you already have with your skin. But generally, also the skin is very difficult to treat Indian skin. Like when we were students and when we were studying abroad, that time they used to say you can use this equipment for white skin, but try not to use for Indian skin. Indian skin is so difficult to treat because we have pigment at moderation. So what happens is if we can lose it, or it can become very bad if the treatment doesn't go on well. So
Yeah.
there could be a hyperpigmentation and a post-inflammatory hyperpigmentation, a very common condition in Indian skin types, are seen very much only in Indian skin types most of the times. Of course, it bothers everybody, but Indian skins are more prone to this. So when you talk about sensitive skin, yes, many Indians have sensitive skin, and you have to be careful about what you're going to apply on your skin. When you have sensitive skin, use basic products and make sure you're not. One more thing about it is not only moisturizing, when you're washing your skin also, that it may be having a bath or have washing your face, you have to be careful with what you're applying on your face or on your body, because what happens is when your skin is sensitive, it tends to irritate whatever you apply. So if you're going to cleanse with some harsh cleanser, so that also bothers the skin, and not only that, that will cause more dryness. And the minute you put something, it's going to hurt your skin some more. So your skin has got more sensitized with everything. So when you have this type of skin, it has to be from whatever your routine be. Everything should be put in perspective, and then you should plan what you're going to do with your skin. And moisturizers for them are many, many, many are available. It's a trial and error, or you can always seek help asking your dermatologist. In spite of that, also, even if a dermatologist has to say that, also there'll be a little bit of trial and error, but be a little more focused trial and error than just randomly trying everything on your face and hurting your skin.
Right, right. So this brings us to the end of our section, doctor. Doctor. One question that people want to know, as a founder of Cureka.com, which is a healthcare platform, serving the masses in India, is this: what is your focus? What are you trying to focus on, and what value do you want to provide to people of India?
We are focusing totally on healthcare and more of preventive healthcare. So we are not here to treat any conditions or anything. We are here to prevent your healthcare issues. So we have a lot of products enlisted which are to for a healthy living, to enhance you to live a better, happy, healthier life. And our aim is to penetrate all through, and we are already, I think, there in all the states, all the cities, and serving many, many pin codes. I think, Rahul, you should be knowing the exact
Yes,
numbers,
yes.
which I'm not great at.
Yes.
So, so we have been doing all that. And in the future also, we tend to help people out. Like, we're planning a skincare range also, which is going to be absolutely 100% plant-based, natural ingredients. And we have all our trials and all done already, and it's helping a lot of people improvise on their skin texture, quality, and live very nice lives. Because we always believe that skin is a mirror to one's good health. So if you're healthy and if you're happy and if everything is fine, then your skin reflects that. So that's what, so it's not only what you look outside, but what you feel inside also. This is
Yeah.
what we want to improvise on. We want you to be happy inside out. And Cureka is
Wonderful.
there to help you out all through and through. And we would be happy to help anybody and everybody the way they wish to take help.
Correct, correct. Thank you so much, doctor. That's a fabulous thing to share. That you have to be good inside out. You have to be good from the inside as well. Beautiful lines, those from Dr. Hema Sathish. Thank you so much for joining us today, and we look forward to connecting with you again in the future. So, thank you, and wish you a very, very happy weekend, doctor.
Thank you.
Thank you
Bye
so
bye.
much. Thank you. So, guys, this was Dr. Hema Satish, the founder and managing director at Cureka.com. You've heard from her live, and she believes in being inside out healthy by keeping you healthy in your nutrition, in your skincare regimen. So, go just give us a chance, give us a try to log into Cureka.com and find out what is the best suited product for you. We have got a free of cost WhatsApp platform which you can use to ask questions from us. And guys, the vision of Cureka is to help you lead a healthy life. So guys, help us to do that. Give us a chance. We are more than eager to perform and try to come up to your expectations. With this, this is your host for today, Rahul Nanuhal. Thanking you so much, and we wish you a very very healthy weekend. Take care. Goodbye, and until the next time, we wish you a very very healthy days. Take care. Bye bye.